Hello, this is Dr. Kave, your physician, anesthesiologist, and integrated medicine specialist. Today, I want to talk about nutritional supplements and how they can land you into the operating room, probably more than what you had signed up for when you took them. So the problem here is that patients come in with loads and loads of supplements, like literally bags of them, and they don't know the names or the doses or why they're even taking a specific supplement. Well, at Stanford and Harvard, they just taught me really to blow these patients off. Not in a bad way, but just because we don't really know what to do with these patients and how to deal with it. Well, the problem is that it's not fair to patients because patients want to just feel better. That's why they're taking them. It's not their fault. My question is, who told them in the first place to take these supplements? Because what if those meds are making you sick, like needing these powerful medications in the operating room or needing breathing tubes that will provide life support and all that? These things go in your mouth like that. They have lots of side effects: vocal cord damage, sore throat, hoarseness. This is real stuff here, and I don't want patients to be taking medications that they think are helping when they really aren't. And it's not just nutritional supplements. The same thing goes for conventional medications as well. I don't discriminate between them because they can both disempower patients to not take care of themselves as well as they could. And that's the issue here. It's the messaging that people get when they offload some responsibility for their health because of a medication or a supplement or an essential oil or an aromatherapy or a probiotic, whatever. Doesn't matter. My concern is that patients aren't taking care of themselves as best as they could when they're given a medication or a supplement that is supposedly doing the job for them. So I totally support natural medications and supplements whenever possible because they tend to be cheaper and have fewer side effects. Why would I want someone to be taking a powerful pharmaceutical if it's not necessary? Keyword is if it's not indicated or necessary. Oftentimes they are, like us here in the operating room. I don't joke around. When patients need powerful meds, I give them, whether it's the ventilator, life support, whatever. I do that. That is our first and foremost job. But for most people in the country, that's not what they're dealing with. They're dealing with chronic diseases like high blood pressure, obesity, diabetes, etc. And this is where there might be a role for nutritional supplements or botanicals to help decrease the burden of powerful pharmaceuticals. But we got to hold it there because a lot of patients are just given loads and loads of pills, or they're pushed pills over the internet, TV ads, social media, you name it. Everywhere we're being bombarded by direct to consumer advertising and direct to consumer selling of these nutraceuticals and these supplements. This is what I have issue with. It's not the patient's fault because if we don't know any better, what are we supposed to do? The issue is when they're pushed these pills and who is pushing them and why. They're going to be dangerous here. Like you said, I don't want you in the operating room here if you don't need to be here, especially if it's because of something that a supplement had caused or something that a supplement had unburdened you from thinking you had to do and took away your empowerment, your ability to take care of yourself. That's what I care about because we have more power over our health than we're oftentimes told by other sources. There is some fascinating research that shows how prescribing a supplement or a pill or whatever can actually change patients' behaviors. Kind of makes sense. When you give patients blood pressure medications, a subset of them are less likely to change their diet and their lifestyle to help take control of their blood pressure like they would ordinarily do it in the first place. Probably some of them have some psychology that's like, if I'm getting a pill, I probably don't need to eat the right foods as much as I ordinarily would, or I need to exercise as often as I ordinarily would. Well, as a doctor, that's enough concern for me to never want to push supplements or pills unnecessarily because oftentimes lifestyle modifications and lifestyle choices are far more powerful than any medication we can prescribe or any supplement or whatever that we can recommend. So what's the best way to spot one of these scams or spoofs when they're trying to just sell you pills? The number one thing is, do they know who you are? There's this rule of medicine that says you need to know just as much about the disease the patient has as the patient that has the disease. When someone is online or on a social media platform pushing a pill, not even knowing who you are, you got to ask yourself, what are they doing? Because if you don't know who the patient is and what their social life is like, etc., how could you be pushing pills or, like I said, probiotics or aromatherapies or whatever? That's not looking at what the underlying cause of the disease might be and just pushing pills to band-aid the situation. Totally not cool. So what are some of the other issues? So whenever someone's pushing a pill randomly on you, not even knowing who you are, do they know what dose to give you? Do they know what other medications you're taking so there aren't any interactions between the supplement and the medications you're taking? Have they ever told you how long you're going to be on that medication, like for 2 weeks, 2 months, 2 years, for the rest of your life? Note that there's a lot of money to be made if you put someone on a supplement or a medication for the rest of their life because they're a lifelong repeat customer there. A lot of money to be made. Watch out for that. Another big problem is that a lot of botanicals and supplements are actually adulterated with conventional medications. What does that mean? It's like medications for sexual intercourse that actually have sildenafil or Viagra mixed into them so that you're actually getting a very powerful pharmaceutical, not knowing what's in there. Or pain relievers that actually have ibuprofen and non-steroidal anti-inflammatories in them as well, but it's not labeled on the actual supplement bottle. It can be very dangerous if you don't know what you're getting. I'm not saying all supplements are bad, and I absolutely support them in the right place at the right time for the right patient, but I don't support blanket recommendations that just push these pills onto people. It's not fair to patients, not fair to their wallet, not fair to their health. So remember, you have more power over your health than they want you to know. Leave your comments below, subscribe to learn more about the medical secrets.